But I also want to recognize some folks who were instrumental in making this happen. First is want to recognize Shiva Shankar, the CEO of EGS Health and Excel Global Solutions, together with the leadership team. Jansi is here, Jerry, Varun, who I'm thankful for. Varun coordinated this webinar to make it happen. SK, the technology guru behind the Medicas app, Girish, and all of the other members of the EGS family. So I want to thank you for joining us. So friends, ladies and gentlemen, firstly, Medicas. Medicas is the Caribbean's most advanced telemedicine platform. It is a platform that connects doctors, patients, labs, pharmacies, and creates an ecosystem. So all someone has to do is download the Medicas app, select the category, select a doctor, pay, and show up. And all medical records are available on this app 24/7. So Medicas is pleased to host this program together and in association with Drs. Dale Maharaj and Rodney Benjamin on this first session called Diabetes and You. It is a very appropriate topic, especially as November is Diabetes Month. Our objective is quite simple. Our objective is twofold. One is to allow greater access of quality healthcare across the Caribbean to all people of the Caribbean. So greater access to quality healthcare. And secondly, to reduce the cost of healthcare by 10 to 20% at least across the board, from doctors' fees to lab cost to miscellaneous medical charges. Our objective is simply that, to reduce the cost of healthcare and to drive greater access to healthcare across the region. EGS Health is here for the long term, and we are prepared to work, and we have been working with several doctors across the region, not just in Trinidad and Tobago, but also in Guyana, in Belize, to the north in Jamaica. We have a partnership with Medical Associates in Jamaica. We are here for the long term to achieve our objective. We are particularly honored today to be working in collaboration with the Diabetes Association of Trinidad and Tobago. And we are very honored to have the president, Mr. Andrew Danu, here with us to give us some of his opening remarks. Mr. Danu, by way of introduction, is currently the president of the Diabetes Association. He's serving his second term of office. And this gentleman has been involved in multiple different positions, multiple different roles over the past several years. He is also director of the Trinidad and Tobago Non-Contagious Disease, or NCD Alliance, and serves on the Ministry of Health Food Advisory Committee. If that wasn't enough, this gentleman is also a lecturer of biochemistry at the School of Nursing, Medical Sciences Division, and he is currently pursuing his doctoral candidate. Immediately after this session, he has another appointment. So, Andrew, we are very pleased and honored to have you on board to open our session today. And I hand it over to you to give us your thoughts on the topic of telemedicine and diabetes. So over to you, Andrew.
Thanks, Anil, and good night, everyone. Let me just share my presentation. So, yeah. Sorry about that. Yes. So good night again, everyone, and thanks for joining us at this presentation. And again, thank you for inviting me and the Diabetes Association to be part of your event, to be part of this initiative. Very importantly, because November is Diabetes Awareness Month, and quite appropriately, the theme is access to diabetes care. And I'm glad that you started off and you were talking about access to care for persons living with non-communicable diseases, and particularly for diabetes. So I want to introduce telehealth and diabetes and talk a little bit briefly about how telehealth and telemedicine can really help persons living with diabetes in Trinidad and Tobago. So telehealth, before we start, of course, I just want to remind everybody that, of course, November is Diabetes Awareness Month, and that's why everything is blue. So blue is the color for diabetes awareness. So all my slides, and you might see me kind of looking blue as well. But what I want to introduce is what is telehealth, and of course, it's a distribution of health-related services, information, electronic information, and telecommunications technology. So it's not just about a doctor interacting or about a doctor interacting with a person or providing services, but also it's about education, it's about information that can be distributed and that and support that can be offered to persons. So some aspects of telehealth, examples of telehealth could be remote patient monitoring, healthcare employee training, administrative meetings, health education, counseling services, health resource coaching, using applications such as the Medicas app to view lab results, track blood sugars and blood pressures, and even refill pharmacy prescriptions. So it's a cycle that involves the collection, transmission, evaluation, notification of the patient, and most importantly, interventions, timely interventions. And why is telehealth so important, or why is telehealth relevant to us in Trinidad and Tobago? Well, because we have many barriers to care, and again, access to diabetes care is important. Access to diabetes care, particularly in the time of COVID-19, we know that persons are limited in the care that they are supposed to receive or they need to receive to take care of their diabetes. So we know that this limitation has brought about additional barriers to what we already have been facing. And of course, telehealth, telemedicine can assist with that. So some of the barriers Trinidad and Tobago has been seeing for the past few decades, and these are some of the things that we have observed at the Diabetes Association, is one, the primary care clinic visits are about 3 months or even at intervals. And for most persons living with diabetes or non-communicable diseases, they don't see a doctor, they don't see a medical professional, they don't communicate with anybody else between the visits that they take. And for most of these persons, they don't tend to adhere to their medication regimes and other sorry about that. Yeah, they don't adhere to their medication regimes as they need to, because again, they don't have that constant reminder, they don't have that support. Limitations in laboratory testing has also been something that has set back a lot of patients and have contributed to poor diabetes care. One instance is HbA1c testing. When we discovered some years ago that for some persons doing HbA1c testing, it takes as much as a year to get back an A1C result. And as most of you would know, in medical professionals here, that's irrelevant after 3 months. So after a year, it makes no sense. Medication adjustment lag time then happens, because if it is that you can't have real-time testing and you can't have real-time feedback, then of course the medications can't be adjusted as they should. Low access to specialist screening and counseling services in rural communities, and we do have this problem in Trinidad and Tobago because there are many communities that cannot, or persons in those communities who cannot reach the care, who cannot reach these specialists, who cannot reach these facilities, or are able to access the facilities. And of course, there's a huge problem of resistance to care, resistance to seek out care, particularly in men. And we have seen that men have traditionally been resistant to care, resistant to seeking out care, resistant to seeking out medical interventions until things get really, really bad. So they'll say, oh, there's a gas pain, or strong enough, and you know what will kill me, make me stronger. Those are some of the sentiments of Caribbean men, which of course we need to change, because the earlier you intervene, the earlier you have screening, the earlier you have intervention, that's when you're going to make those changes. And how can telehealth help? Well, It allows for regular contact with your diabetes team. So diabetes team meaning your nurse, your doctor, your nutritionist, exercise specialist, and it allows for the capacity through applications like Medicas, through telephone calls or any other telehealth platform. It allows for you to communicate with medical professionals easier so that you can have that support throughout the year, throughout the month, in between clinic visits. It could allow for at-home monitoring with at-home monitoring devices and point-of-care testing as well. You have real-time medication adjustment management now, and you could even, at some points in time, just like you will see with Dr. Melinda, you will see that doctors can be available at 24/7 for persons in need through these telehealth platforms. Unwilling persons as well may be more inclined to speak to physicians or more inclined to seek healthcare if they are in an environment at home that may be more comfortable for them. So here are the reasons why telehealth is so important for persons living with diabetes. One such example of telehealth application and a device, this wearable device, is a continuous glucose monitor. And some of you may know it, some of you may see it, some of you may have seen it before. And it is a device put on the arm, and this device could allow persons living with diabetes to continually track their blood sugar readings. And of course, their healthcare providers could get it in real time, their families could get it in real time. And here is where you have an intervention that could actually drive change for persons living with type 1 diabetes in particular, and for children living with diabetes. And we have been trying to get these devices for children in Trinidad. Again, through the help of Medicas, we hope that we can get these devices for children soon, at least for children, make it more accessible, that is. So that's really, in a nutshell, how telehealth and telemedicine can assist with persons living with diabetes, and in Trinidad and Tobago. Just to wrap up, again, Diabetes Awareness Month, and it is November, and this is our calendar of events. We've rolled out quite a lot of activities. We have a webinar as well tomorrow for World Diabetes Day, but we have a series of activities throughout the month, eye screening and foot screening, and charity events, quizzes and workshops. So you could follow on the Diabetes Association Facebook page or Instagram pages, and you could call us at 607-DAT or 607-3288 for more information. So thanks again for working with us, and thanks again.
Good. Thank you very much, Andrew, especially as you have a very busy schedule. Andrew has to leave us in a few minutes. He has another engagement. I just want to recap what Andrew has said, and that was a very provocative presentation. The world has changed. The pandemic has accelerated change that was inevitable. And safety, convenience, and so on. The trend is moving away from going to brick and mortar facility for services towards services coming to us. And this is the telemedicine concept that Andrew spoke about, where a patient could have a clinical encounter with a doctor surrounded by labs and pharmacy. The patient can view the doctor's capabilities, schedule an appointment, they can have a consultation. If there is a need to visit in person, fine, an appointment could be made. A prescription, what we call an e-prescription, can be issued directly to the pharmacy. We will have pharmacy delivery same or next day. And coming very soon, something that we are very excited about, and that is 24/7 doctor for $50 TT, or the equivalent of $80 US, starting in Trinidad and Tobago and then moving across the region. I want to recognize certain members who have joined us. Firstly, Dr. Dale Maharaj, one of the most, if not the most senior vein and vascular surgeon around. Dr. Maharaj, welcome. I see Dr. Ricardo from Guyana is here. Welcome. Dr. Karen Phillips, endocrinologist from Jamaica. Dr. Phillips, thank you for coming. Welcome. Dr. Kumar Sukraj, he's a very specialist endocrinologist. He runs a clinic in Guyana, one of the more highly sought after doctors in Guyana. Dr. Sukraj, welcome. And I see Zubida has joined, Ragbir Singh. Ms. Zubida Ragbir Singh has joined. She's a former president of DATT and VP, a health professional at the IDF. So welcome everyone, and thank you for joining us. For those of you who just joined, I just want to recap our objective. Our objective, meaning EGS Health, which is a US-based organization. EGS Health developed Medicas, a telemedicine platform. Medicas was born during a pandemic for the people of the Caribbean region as well as the world. It was launched in India a short while ago. We have now brought it to the Caribbean. After here, we're going to Qatar and then to other parts of the world. Medicas is a telemedicine clinical platform, and it was designed in India by a remarkable team of specialists and supported by some remarkable people. For example, SK, as we know him, Shiva Kumar, we have Varun, there we have Girish. Some of the world's best talent is supporting this technology solution. So even though we are based in the United States, we are working across the Caribbean in collaboration with Dr. Dale Maharaj and Dr. Rodney Benjamin to achieve these two objectives. Firstly, to get greater access to quality healthcare. Secondly, to drive the cost of healthcare down significantly by at least 10 to 20%. And an example of that is 24/7 Doctor, where very soon, anytime, day or night, you can get access to a doctor through video, chat, or phone for $50 TT or $8 US. And that is part of our commitment long term. We are here in the Caribbean for the long term. So, and what we're doing right now, and we're still in the early stages, is building out the solution. Now, we come to the highlight of our afternoon, and I want to recognize and thank Dr. Melinda Nancoo, who is our featured speaker on the topic of diabetes and you. This doctor is highly accomplished and highly recommended. She's based in Trinidad and Tobago. Dr. Nancoo completed her medical degree at the University of the West Indies at St. Augustine in 2010. And she went on to practice internal medicine in the public sector, and she attained membership at the Royal College of Physicians, UK. She's a specialist of internal medicine, which she achieved in 2015. She completed her UK certification in acute medicine in 2016 and endocrinology and diabetes in 2018. Dr. Nancoo completed her fellowship in endocrinology and diabetes in the United Kingdom in 2019, and then she decided to return to Trinidad and Tobago, much to the benefit of the Caribbean. She is currently in practice as an endocrinologist and has a private practice in Trinidad and Tobago. Dr. Melinda is on the Medicas app, which you can download during the session, either in the Apple Store or Android Store, Medicas. You can download and register, and you can see Dr. Melinda together with over 25 other specialists. So at this point, I am very pleased to invite Dr. Nancoo to talk to us about diabetes and you. There are a number of questions she's going to answer. At the end of this session, we will pause for a question and answer session. So this will be your opportunity to send your questions in. There's a chat session. You can send it via chat, or just ask to voice your question, and we will have Doctor address it. So Dr. Nancoo, over to you.
Good night, everyone. Thank you to Medicas for asking me to speak this evening. And thank you to everyone for joining us and giving me some of your Saturday night. So we'll go straight in. Right, so we're going to talk about diabetes this evening. So what we'll be going through, some of the questions would be: what causes diabetes? what are some of the symptoms and how diabetes is cared for, the alternatives to a finger stick, is diabetes curable, what's the treatment for diabetes, and we'll talk about living with diabetes. And of course, we'll have the question and answer session. So what is diabetes? So diabetes is a disease in which insulin is either not produced or the insulin is just not enough for the body's needs. So insulin is one of the hormones that are produced by the pancreas, the organ called the pancreas. And it's responsible for keeping blood sugars within a healthy range. So what's a healthy range? So in a fasted state, the blood sugar reading should be between 70 to 99 milligram per deciliter. And at other times of the day or at other times, it should be less than 140 milligrams per deciliter. So when you don't have enough insulin, or if the insulin doesn't work properly, blood sugar rises. So there are two main types of diabetes. There's type 1 and there's type 2 diabetes. In type 1 diabetes, the pancreas doesn't produce any insulin at all. So it doesn't produce any of its insulin. So these people actually need insulin injections to survive. And it usually develops early in life. It can develop later in life though. And type 2 diabetes, which is the most common type, it happens when the body is resistant to the insulin that is produced by the pancreas. So the insulin doesn't work properly and is considered a lifestyle disease. And we'll focus on type 2 diabetes in this webinar. So just to show you how big a problem this is, in Trinidad and Tobago, at least 140,000 people have a diagnosis of type 2 diabetes. And this is information from 2010, so the number would be a lot bigger now. And many more probably have diabetes and they don't even know it, or they may have pre-diabetes. And worldwide, 9 out of 10 people with pre-diabetes don't even know that they have it. So who's at risk? So if you have a generally unhealthy diet, and we'll talk about that later on, you're at risk. If you have generally a sedentary lifestyle, if you're overweight, if you have fat stored mainly in the abdomen. So that's defined as a waist circumference that's more than 40 inches in men and more than 35 inches in women. If you have blood relative to a diabetic, you're at risk. If you have a history of diabetes that occurred during pregnancy, and that's also called gestational diabetes, that puts you at risk for diabetes later on in life. Polycystic ovarian syndrome, which is fairly common in young women in Trinidad and Tobago, that puts you at risk. And your race and ethnicity as well. So Asians, Indians, and Blacks are more at risk. And that sort of makes up a good proportion of the population of Trinidad and Tobago and the Caribbean. If you have high cholesterol as well, you're at risk. You're at increased risk as you get older. And if you have areas of darkened skin on the armpits, behind the neck, on the side of the face, that often indicates insulin resistance, and it means you're at risk for diabetes, for type 2 diabetes. So let's talk about these symptoms and care. So when there's not enough insulin to keep the blood sugars in check, the blood sugars rise, and that's when it causes damage throughout the body. So diabetes can cause damage to the small vessels in the body and also to the large vessels in the body. And when it causes small vessel damage, we call it microvascular damage. Micro is small, vascular is vessel. And similarly, when it causes damage to the large vessels, we call it macrovascular damage. So some of the microvascular or small vessel damage that can happen would be damage to the eyes, the kidneys, and the nerves. And this could lead to blindness, kidney failure, and toe or lower limb damage that requires amputation. And in terms of the large vessel damage, this could lead to heart attack and stroke. So what are some of the symptoms? So if somebody has diabetes or they have high blood sugar and they don't really know it and it's not being treated, some of the symptoms would be excessive thirst, having to pass urine very often, blurry vision, fatigue, recurrent skin infections or abscesses, poor wound healing, yeast infections, and weight loss. So how is it diagnosed? So type 2 diabetes is typically diagnosed by blood tests as well as a history of the symptoms we just listed. So usually one or more of the following tests are usually done. So a fasting blood sugar level is sometimes done. And if that's more than 126 milligrams per deciliter, we say that's diagnostic of diabetes. Sometimes if we don't do a fasting blood sugar, we could do a blood sugar at any other time of the day called a random blood sugar level or blood glucose level. And if this is more than 200, then we say it's diagnostic of diabetes. An HbA1c test can also be done, and that's done regardless of a period of fasting. You don't have to be fasting for that, and we'll talk about that a little bit more. And also an oral glucose tolerance test can be done, which is when you ingest a certain amount of glucose, and then we check your response to it by checking your blood sugars about 2 hours after. So let's talk about the HbA1c test. So what it does, it tells us the average of blood sugars over the past 3 months. And it's also used to measure control of diabetes. So the US and the UK have slightly different figures, but generally a normal non-diabetic person has an HbA1c of less than 5.9%. That's according to the UK guidelines. The US guidelines are a little bit more strict. So they say for you to be considered normal and non-diabetic, your HbA1c should be less than 5.7%. And you're considered to be pre-diabetic if you're between 6% and 6.4%. And that's according to the UK guidelines. The US guidelines would be 5.7% and 6.4%. And diabetes is considered to be an HbA1c of 6.5% and above. And generally, when we use the HbA1c test to measure control of diabetes, we consider good control to be less than 7%. And in some patients, we could even aim for a stricter target of 6.5%. But target is very individualized. And generally, your doctor will discuss the right target for you. The right target for you isn't necessarily the right target for somebody else. So what about the alternatives to a finger stick? A lot of people don't really like sticking their fingers. So Mr. Andrew mentioned it. He mentioned continuous glucose monitoring systems. They're not, unfortunately, widely available in Trinidad and Tobago, but it might be available in some of the other Caribbean islands. And it's generally available by prescription in the US and the UK. And just 2 examples would be the Freestyle Libre and the Medtronic Guardian Connect. And how they work, they consist of a sensor and a reader. So you would have seen a picture of it in Mr. Andrews' presentation. So the sensor is applied to the arm or to the abdomen. And the sensor has a 5 millimeter long filament that's attached to it. And that goes into the skin. And when it goes into the skin, it's able to sample the blood sugar of the fluid between the cells. And the sensor can be worn for anywhere between 7 and 14 days, depending on the brand that you have. And in order to read the blood sugar, what you do is you just take the reader, or some of the newer models, the reader is actually just your phone, your smartphone. You take it and you just swipe it past the sensor, and you have your blood sugar reading on your phone. They're a little bit costly, so generally it would cost you probably about 1,100 TT a month to 3,000 TT a month. So they are a bit costly. So is diabetes curable? So this is $1 million question. Everybody wants to know this. So it depends on, we have to define curable. So the definition of cure really means the elimination of a disease or a condition. That's what cure means. It means that it's gone and it won't come back. So in that case, is diabetes curable? No, as of today, there is no known cure for type 2 diabetes, but it can be controlled, and in some cases, it can go into remission. So we'll talk about remission and what I mean by remission. So remission means that the disease is basically asleep. You've heard about people having cancer that goes into remission. It doesn't mean that it's completely gone. It could still come back, but it's not active. So for diabetes to be in remission, it means the HbA1c and the blood sugars will actually be normal without medication. It doesn't mean that it won't come back, right? So if the body is stressed enough, so if there's a period of severe illness, if the person has weight gain, if they have to use steroids for any particular reason, and if they resume a high carb and a high sugar diet, and we'll talk more about that later on. If any of those factors happen and somebody's in remission, the blood sugars can rise again and the diabetes can manifest again. So what makes remission likely? So it's more likely to happen in somebody who was recently diagnosed and the diabetes was only present for a short period of time. That makes it more likely. And it's more likely if you've had weight loss surgery or bariatric surgery. So if you're over a certain weight and if you have other conditions such as diabetes and high blood pressure and so on, bariatric surgery could be indicated for you. And this, what it does, it reduces the capacity of the size of the stomach. So your appetite is reduced, you eat less, and then you end up losing weight. And this causes rapid weight loss. And remission is considered to be achieved if your blood sugars are normal without medication for 3 months after bariatric surgery. So you must be without medication with normal blood sugars for 3 months after bariatric surgery to be considered to be in remission from diabetes because of bariatric surgery. But what if you don't qualify for bariatric surgery? You can't get it done. If you follow a diet that's fairly low in carbs or low in high glycemic index carbs, which we will talk about, if you have a lifestyle change where you are more active, and if you achieve weight loss through these changes, and that's generally considered about more than 10% of your body weight, without medication, then we consider that you're in remission if you're off medication for 6 months after these changes. So after lifestyle change, if you're off medication for 6 months, we consider that you're in remission from type 2 diabetes. So it is possible. So what's a treatment? So diet is a cornerstone of treatment for type 2 diabetes. And we'll talk more about it again. And also lifestyle modification. And then if those don't work, then we use medications and insulin. So I just wanted to get some answers from you all in the polls. So how much soft drink do you consume per week? So do you consume none at all? 1 to 5 bottles a week? 6 to 10 bottles a week? Or more than 10 bottles a week? And I'll give you about 30 seconds. Okay, so I think that's just about 30 seconds. See if we have any. Do we have any answers? Oh, yeah. Okay, so we have the answers. So 53% of you said none. So that's excellent. That's really good. 43% of you said 1 to 5 bottles a week. And none of you said 6 to 10 bottles a week. But about 4% of you all said more than 10 bottles a week. Okay, thank you for participating. So we'll talk more about soft drink later on. And I'll probably scare you a little bit. Right, so diet. So the food a person eats plays a really big role in their diabetes management. And I want you to recognize that there's no diabetic diet. Because quite often people come and ask me what's the best diabetic diet to follow. There's no diabetic diet. The diet that's recommended for people with type 2 diabetes is really just a simple, healthy diet that really everyone should be following. And what you should focus on really are having foods with a low glycemic index. So what's a glycemic index? What's a glycemic index? So the glycemic index is a value that's assigned to food based on how slowly or how quickly these foods cause an increase in blood sugar levels. So for instance, the highest glycemic value is 100, and pure glucose has a glycemic index of 100. So you want to have foods that are below a glycemic index of 100 and as low as possible. So the higher the glycemic index, the more like sugar or like glucose the food will behave. So foods with a high glycemic index would raise the blood sugars quickly because they would act more like sugar. So these are foods that you should eat in small quantities and you should avoid. And foods with a low glycemic index would actually cause a low rise in blood sugar, a slow rise in blood sugar, and they keep you fuller for longer and they're better for your health. So what are some examples of high glycemic index foods? So it's everything at the top there with that red arrow. So sugary drinks like the soda, juices, take note, juices have a high glycemic index because they still do have sugar in them. Sweetened cereals, white bread, and white rice. So you'll see at the top there, there's cornflakes, and there's white bread and donuts and so on. So cornflakes is right up there with white bread and donuts. So if you're having cornflakes for breakfast, you really have to consider the glycemic index of the type of cornflakes you're having. So low glycemic index foods, some examples would be like chana or chickpeas, lentils, peas, eggplant or baigan, broccoli, cabbage, nuts, and seeds. And those are the foods that you want to eat more of because they will have a more steady rise in your, really slow, steady rise in your blood sugars, and it would keep you fuller for longer. So sugary food and drink raise blood sugar levels, but also starchy foods such as rice, bread, and pasta, they turn to sugar as well. So they cause a spike in blood sugar as well, because starch is broken down into sugar in the body. So they should be eaten in small quantities, but it's not that you have to avoid it completely. The type of starch matters. So you want to choose things like whole wheats and whole grain over just plain white flour. So whole wheat or seeded bread or roti and bake is better than just plain white flour, roti and bake. And ground provision, which we have an abundance of in the Caribbean and is our local food, ground provision is much better than white rice. It has a really nice low, most of them have a glycemic index between like somewhere like about 40 to 60. So that's really good. So ground provision is good. It's better than white rice. So fruits, I get this question often. So some fruits like mangoes, oranges, and grapes are the biggest culprits. And very ripe bananas, they should be eaten in really small quantities because they have a high glycemic index. And you'll see at the bottom here, they have dates having a glycemic index of 103. So it's almost worse than sugar. It can send your blood sugar up pretty quickly. All right. But something like cherries and apples have a lower glycemic index. So you have to be careful of fruits. And once again, it's not that you have to avoid it completely, but your portions matter. So what about portions? So this is called the Eat Well plates. So it has the food portioned out, an example of how the food should be portioned out. So quarter of your plate should really be meats or your meat alternatives. Quarter should be healthy, nice, low glycemic index carbohydrates. So it's not like you have to avoid it completely. You can have quarter of your plate could have healthy carbohydrates. And the other half of your plate should be vegetables, beans, and salad. And that's just how everybody should eat. So drinks. So the best thing to drink is water. Water is the absolute best thing to drink. So I'm not going to single out any particular soda, but we'll talk about, this is an example of a can of soda. And what I want you to pay attention to every time you go to drink something or eat something, if it's packaged, look at the nutrition label. So you see this thing here, the sugars, 39 grams. So 1 teaspoon of sugar is equal to 4 grams, right? So if this can of soda has 39 grams in it, it basically has about 10 teaspoons of sugar. So that's 10 teaspoons of sugar you ingest in if you just have 1 can of soda. And then if you have one of those bigger bottles of soda, this one has 55 grams in it. So if you had that entire bottle, that's almost 14 teaspoons of sugar in just that one bottle. So just be aware of what you're putting into your sugar. This is just simple sugar. It's high glycemic index. It goes straight into your bloodstream, spikes your blood sugar. In fact, if you're diabetic and your blood sugar drops low for any reason, the treatment is actually to drink something with sugar in it. So something like Lucozade is what we tell people to drink, or some soft drink if you can't get any Lucozade, because it is that effective at spiking your blood sugar. And there's some sodas that are marketed for kids in nice little tiny bottles. And this is an example of one. And if you see there, that's 26 grams of sugar. So that's more than 6 teaspoons of sugar that is in that little bottle of soda that's marketed to kids. And if you think about if you were giving your kids something to drink or something to eat, you wouldn't take 6 teaspoons of sugar and just put it in a cup and give them a spoon and tell them, here, eat this, right? But that's what's in soda. So pay attention to nutrition labels, get in the habit of just looking at the back of packages and looking at these total sugars there to see what you'd be surprised at what things have hidden sugar in them. Things like granola bars, pasta sauce, things you wouldn't really suspect, and that should be healthy. So let's put up the second poll. So tell me, how often do you exercise? Not at all, rarely, sometimes, or often? And I'll give you 30 seconds to answer. We'll give you a little bit more time than 30 seconds. Give everybody a chance to answer. So how often do you exercise? Not at all, rarely, which is 1 hour per month or less, sometimes, which is 1 to 2 hours a week, or often, which is more than 2 hours a week. So I think that's just about a minute. So let's see. Good, so just 9% of you all said not at all. 24% said rarely, which is 1 hour or less. 37% said sometimes, which is 1 to 2 hours a week. And 30% of you said often, which is more than 2 hours a week. So that's really good. Great. So we'll talk about exercise a little bit more. Good. So when we talk about lifestyle change and lifestyle treatment for diabetes, regular exercise should be part of your treatment. So when I say exercise, I don't necessarily mean lifting weights or doing a really intense aerobic class or anything. It doesn't have to be that. It just depends on your level of fitness. And what I tell patients to start off with is just some walking, some brisk walking. That's a good place to start. And then if you manage a brisk walking and you're okay with it, and as long as you have no cardiac issues, and you could go ahead and start taking a little jog, and then you could start walking, and then you could start incorporating some weights as well. So what's recommended is a total of 30 minutes a day, 5 days a week. And that equates to about 150 minutes of exercise a week. And that's the recommended amount of exercise. 30 minutes a day, 5 times a week. And you could break that up as well. You could do 15 minutes in the morning and 15 minutes in the evening for 1 day to get your 30 minutes. And definitely do not smoke. If you don't smoke, that's great. Don't start. If you do smoke, get help to quit. That's one of the most important things you can do for yourself, to stop smoking and to not smoke. So let's talk about medications. So your doctor might recommend tablets if diet and lifestyle doesn't work. And some of the more common ones you might hear would be metformin, glycoside, and some of the newer ones are, they have funny names. So one of them is called dapagliflozin. There's also empagliflozin as well. And there are also new injectable drugs, not as widely available, but they are available. And some of these are injected daily, some are injected weekly, and they help with diabetes control and also with weight loss. They're pretty good with weight loss as well. And if the tablets aren't enough, insulin is then added. So some common types of insulin would be insulin 70-30. That's quite often what a lot of people are on, and also glargine insulin. And other conditions should be treated as well. So high cholesterol and high blood sugar should be treated as well because they go hand in hand with diabetes. So this is a third poll. So tell me, do you have regular health checkups? Yes, do you have regular health checkups every 1 to 3 years or even more often? Or do you just not have any regular health checkups? And I'll give you 1 minute to answer. So I have a lot of questions coming in, so I'll try to be, I'll wrap up soon with my presentation so we can get to your questions. Okay, so I think that's enough time for the poll. So let's see. Good. So about 82% of you said you have regular checkups every 1 to 3 years. So that's great. Only 18% of you said you don't really have regular health checkups. Good. So right, what's really recommended, so at least annual checkups with your regular doctor should be, you should have annual checkups if you have diabetes. And generally what should happen at those checkups, your doctor should review your general wellness and your symptoms. The HbA1c test is done to estimate your control. That's generally how we estimate your control. Sometimes we might ask you to bring a blood sugar diary and tell us how your blood sugars are doing. You should have blood pressure checks at each visit. And you should have your cholesterol and kidney function blood tests done at least once a year. And at least once a year, you should have an eye exam by an eye specialist. And when I say eye specialist, I mean those eye doctors that do surgery. So the ophthalmologists, so those are the ones that do cataract surgery and so on. So not necessarily only by the optometrists, although some of the optometrists are really good now at detecting any eye problems. But you should have a really in-depth examination by an ophthalmologist at least once a year. And at least once a year, you should have your foot examined by your doctor to assess your nerves and your blood supply. And just to wrap up, just remember there's no special diabetic diets. A diabetic diet is simply a healthy diet that should be followed by everyone. It doesn't mean giving up your favorite foods. Moderation is key. I know that's boring to hear, but that is true. Moderation is key. Everything in moderation. And living with diabetes just means following a healthy lifestyle, and is how everybody should live. So thank you. And I'll be happy to start answering some of your questions now.
Okay. Thank you very much, Dr. Nancoo. That was very comprehensive. Well, the panel has certainly gotten quite a lot of questions. So before we go into the questions, I would like to say this for the benefit of everyone. And that is, what Dr. Nancoo has done is cover a broad range of topics. We would always advise before any patient, anyone with diabetes, change their medication or try to adjust their diet, they consult their doctor. Your doctor would have your patient history So what may work for someone may not work with diabetes, may not work with another person also with diabetes, because the patient history and the case management will be very different from one patient to another. So we always advise that yes, let's improve our understanding of this condition, but always go back to your medical practitioner. So we've gotten a lot of questions. We'll see how many of these questions we can answer. So Dr. Nancoo, one question is, what causes a person to go from type 2 diabetes to type 1?
Okay, so you don't necessarily go from type 2 to type 1. So what happens is if type 2 diabetes is present for a really long time and the body becomes so resistant to the insulin that your own insulin doesn't work anymore, you become dependent on getting insulin from the outside to be administered. And sometimes the pancreas, which is the organ that produces insulin, it becomes very burnt out by producing a lot of insulin all the time that your body isn't really responding to. So that's why you end up needing insulin. And it's not the same thing as type 1, because you still have some insulin being produced by your body, but it's just not working very well, or your pancreas might just be burnt out. So that's what usually tends to happen.
Okay, thank you. The other question you answered, and that was, is type 2 diabetes curable? But doctor has already answered that. The other question is, what is the benefit of exercise and the management of diabetes? In particular, the person wants to know that she has noticed that blood sugar spikes during exercise. And she wants to understand what causes this, and is it a concern that needs to be managed?
Yeah. So exercise, especially intense exercise. So when you have intense exercise, you have an increase in the hormones like adrenaline. And what adrenaline does, it actually causes a little bit of a spike in your blood sugar. So you would find if you have a period of intense exercise, your blood sugar does spike after the intense exercise, but it will eventually come down. So it is not an indication to stop exercise, no, even to reduce the intensity of your exercise, right? So, but you can't expect that little spike afterwards. There's nothing to worry about. It will come down eventually. But exercise in particular is very important. It's not only important for your cardiovascular fitness or your heart, for your heart, but if you build muscle and you maintain your muscle helps to use up some of that extra glucose while you're just resting, and it increases your metabolism. So that's why you get this spike, because of adrenaline.
Okay, thank you, doctor. Is there any benefit of drinking vinegar before meals to manage blood sugar levels?
Yeah,
I know. Go on, doctor.
Yeah, so I don't have any actual evidence or any papers to back that up or to tell you yes or no. I do get a lot of anecdotal stories from my patients who say vinegar works, cinnamon works, garlic works. As far as I know, there's really no actual benefits. If it works for you, I just say just be careful of your teeth and your dental health if you are going to be drinking any amount of vinegar.
Very good. This other question is very common across the Caribbean, and that has to do with coconut water. Is coconut water good for persons with diabetes?
Yeah, so coconut water does have a little bit of sugar in it, right? So it's something like 6 grams, which is like a teaspoon and a half of sugar in about a glass of coconut water, right? So a glass now and then isn't gonna hurt, but some people find it does spike their blood sugar. So it really depends on you. So what I usually tell patients is just check your blood sugar afterwards, see what it's done. But then also think about your portions, because you might have a glass of coconut water, but I had one patient who was just drinking probably like an entire big 2 liter per day. And of course it was spiking her blood sugar. So I would say, yes, you can have some, but remember it does have some sugar in it. So in moderation.
That's good. Thank you. The next question is around coffee. Can caffeine offset blood sugar levels? What is the impact of drinking coffee or any product with caffeine on blood sugar levels?
Yeah, so if it's just a plain black coffee, the caffeine can cause a similar effect to adrenaline. So it can cause a little spike in your blood sugar, not a massive one, so it shouldn't be too bad. So just general black coffee is fine. But the problem would be what people add to their coffee. So people will tell me the coffee raised their blood sugar, but then when you ask them, what did you add to the coffee? Well, they add condensed milk. So the condensed milk is a problem. It's not really the coffee. But yes, you might get a little bit of a spike if you have caffeine.
Okay, good. For someone with diabetes, whether type 1 or type 2, is there any advice you can give doctor with regards to any injury, in particular cuts and wounds?
Yeah. So I would just say you need to be a bit more careful than somebody else who's not diabetic, especially if your diabetes isn't very well controlled. You need to consider what caused the injury. So especially if it's like a dirty object, the wound needs to be clean. So sometimes you could use just a little couple drops of Savlon in some water that's diluted to clean the wound out. But what I would say is definitely get a doctor to take a look at it. You might need something like a tetanus booster or a tetanus shot. And they would need to also take a look at it, especially if it's starting to get warm and red, if there's any color change in the area, if there's any pus coming out to the area as well. So I would say you need to be very careful about cleaning the wound, but make sure and seek medical advice.
Yes, and doctor, on that question, one of the reasons why we are coming out with 24/7 urgent care. So 24/7 doctors available, nominal cost 50 TT, 8 US, for situations like that, from anything from a tummy ache, migraine to, hold on, someone with diabetes getting a cut, what to do. We'll have 3 more questions. I'm looking at the time. So this question is, why not eating on time sometimes causes a spike in blood sugar, is what this person has experienced. And the person would like to know what causes this.
Yeah. So it's a lot of different factors. It might be also, so is this person on medication is the other question as well too. Are you on insulin? So it might be the timing of your medication is a little bit off in terms of your food. If you have a spike as well too, that same thing with the adrenaline spike, it can cause a small spike in your blood sugar as well. So that can be a cause of it as well. Also, if you're very stressed, your blood sugars can go up. So that might be one cause. But definitely sit down with your doctor because they can look at all the different factors and talk and try to figure out why it is happening.
Okay, thank you, doctor. What causes gestational diabetes in pregnancy? With some women, it shows up and remains after pregnancy.
Yeah, so you're more at risk for gestational diabetes if you have, because of your ethnicity. So if you're Asian, Indian, Black, you have a greater risk for gestational diabetes. Also, if you have your first pregnancy later on in life, and if you have a really small gap between pregnancies as well, if you're overweight as well, and if you've had polycystic ovaries before, it puts you at risk for gestational diabetes. And the other thing is quite a lot of women would have had pre-diabetes before pregnancy and may not have known it. And when you get pregnant, what happens is the placenta. So the placenta, while it's nourishing the baby, it also increases your insulin resistance. So as the pregnancy progresses, you are more resistant to your body's own insulin and you develop gestational diabetes. So that's how it comes about. And in most women, if the diabetes wasn't present before, and it just manifested only in pregnancy, it tends to go away. As soon as the placenta is out, as soon as the baby is out, you can stop taking the medication, your blood sugars go back to normal. So the diabetes resolves. But if it was present before, and particularly if you gained a lot of weight in the pregnancy or you were pre-diabetic before the pregnancy, it may stay. So that tends to happen. I would say is a very common thing in Trinidad. If you talk to women who are diabetic now and they're in their 60s, they would say they developed diabetes when they were pregnant. So I would say definitely if you had gestational diabetes, you need at least yearly checks to make sure your blood sugar stays normal.
That's good. Thank you, doctor. The final question, and we have a lot of questions coming through. So unfortunately, given the time and we committed to 1 hour, we will have future sessions. So Dr. the last question is around what time should someone stop eating on an evening? It's a two-part question. So that's the first part. What time should someone stop eating on an evening? And is there a recommended time in the morning to take a reading?
Yeah. So, what time you should stop eating? It is really individualized. I don't have a exact answer to tell you stop eating at 6 p.m. or whatever. So that's really up to you. It depends on your activity level. It depends on what time you're gonna stay up at night. Honestly, generally we stay about 3 hours before you go to bed, just so that you have a chance to digest your food, right? In terms of the morning, if you've had a period of fasting, so if you didn't eat overnight for at least 8 hours, then you could do your blood sugar as soon as you wake up. Once it's a fasting reading, or just before you have your breakfast, is considered a fasting reading. So first thing in the morning is fine to check your blood sugars.
Okay, very good. So we have probably about 40 questions in all, over 40 questions in all. And unfortunately, everyone, we won't be able to answer all on this conversation. But what I would encourage you to do is, we have the Medicas app here. You can download it. We have specialists like Dr. Nancoo here. Based in Trinidad, we have Dr. Kumar Sukraj based in Guyana. We have Dr. Karen Phillips based in Jamaica, and many more doctors who will come on board. And the cost of a doctor on the telemedicine platform Medicas is cheaper than the cost of an in-person visit. As I said at the start, our ambition is twofold. The first is to increase the penetration and the access of quality healthcare across the Caribbean. And secondly, to reduce the cost of healthcare, not just in doctors' fees, but also in the labs and pharmacies and so on. And eventually we will get there. So with that said, I sincerely want to thank all of you for attending. I know it's Saturday night. You're here with us, and I really appreciate it. I want to really thank Dr. Melinda Nancoo. Dr. Nancoo, I thought that was a very, very good presentation. You've covered quite a wide spectrum of issues. And I believe I know you've gotten in quite a significant amount of engagement, because I'm still seeing questions coming through different medium. So I want to thank you very much. I want to thank the president of the Diabetes Association, Andrew. He had to leave for another appointment. So just to say thank you for that. I want to thank the folks at EGS, Shiva Shankar, he's the president and CEO based in the United States. Jansi, Jerry, Girish, Varun, who is the mastermind pulling this all together in the background. Varun, great job. I want to thank you very much. Medicas, in collaboration with Drs. Dale Maharaj and Dr. Rodney Benjamin, have established this platform across the region. You will be hearing more about us. In the interim, please download the app, try it. There's no cost to it. Coming very soon is 24/7 Doctor. And we already have, in fact, we went live last week on pharmacy, where there are 3 ways to order your pharmacy drugs, whether it's prescription or non-prescription, and you can get it delivered same or next day across Trinidad and Tobago initially. Then we will go into Guyana, Jamaica, and then everywhere in between. So Medicas is in the 20 CARICOM territories currently. We are brand new, literally we went live with our first consultation 2 weeks ago, and we will be building out the platform even more. So I want to thank all of you for attending. We will be in touch, and I wish you all a very safe and productive week coming ahead. And finally, again, to Dr. Nancoo, great job, thank you. And to everyone, have a good night. Keep well.
Good night, everyone.